Good morning, everyone, and welcome to our weekly Teletown Hall. This is Bill Miles with the Hilton Head-Bluffton Chamber of Commerce, and we're delighted to have you joining in with us again today. Not only those who are dialed in listening to us, but also those who are participating with Facebook Live, as well as watching on the Beaufort County channel this morning. Well, what a great day it was yesterday, and it's wonderful to be able to start off our call today with some great news. And just yesterday, Hilton Head Island was once again named America's #1 island, and that's for the 4th consecutive year in Condé Nast Travelers' coveted Reader's Choice Award. So that's right, not 1, not 2, not 3, but 4 consecutive years. And we are very fortunate to have that ranking. You know, it's a tremendous honor to be recognized once, but to repeat 4 times certainly says a lot about a destination and the reputation that we've been able to garner among travelers. And the recognition, that certainly goes to our community, our resorts and our hotels, our restaurants, and all the businesses who provide excellence each and every day, along with delivering on that guest experience that resonates so well with our travelers. I can't let the moment pass this morning without also recognizing and thanking our residents. And it's our residents' warmth and hospitality that is really so critical in making our guests feel welcome on Hilton Head Island and in Bluffton. In addition to Hilton Head Island being named America's #1 island, many of our resorts were recognized as well. Making the list for the top 10 resorts in the South were the Inn and Club at Harbor Town, as well as Montage Palmetto Bluff and Palmetto Dunes. Then also yesterday, the news just kept getting better and better, and being able to recognize today and thank our partners with the Savannah Hilton Head International Airport, who have taken the top slot this year and have been named the #1 airport in the U.S. And certainly want to congratulate Greg Kelly and Lori Lyon and their teams there at the Savannah Hilton Head International Airport. They're a tremendous group to partner with, and being the #1 airport in the continental U.S. is huge. Kudos for them. And it's astounding when you consider that over 710,000 votes were cast by the loyal readers and followers of Condé Nast Traveler. So to kick our call off this morning, we have the man himself back with us again, the U.S. Editor-in-Chief of Condé Nast Traveler, who has the enviable job of writing about the best destinations in the world. He and his editorial team help readers discover the best luxury travel, and we're proud to be at the top of the U.S. Islands list. Jesse's going to tell us about how the awards have become among the most coveted honor bestowed in the travel industry, as well as talking a little bit about traveler sentiment and what they're seeing in the realm of tourism and hospitality. Jesse, thanks for joining us today, and it's certainly an exciting day for all of Hilton Head Island and the surrounding areas, and we're looking forward to hearing from you.
Thanks, Bill. It's a pleasure to be here and to see all of you once again. Good morning, everybody. And first and foremost, let me raise a cup of coffee to all of you and congratulate you on your well-deserved win for #1 domestic island for the 4th year in a row, and congratulations to Savannah Hilton Head as well, and to all of the other honorees on this year's list. I think it's awesome, fantastic. Raise a glass of your own. What I want to say most of all about this year's list, and I'm sure you all recognize this too, is that it's different, right? It's different from any other year. It's the first time that our audience was voting without, nobody was out there at the moment that they were voting. Look, people were actually casting their votes in April, May, and June, which is the time I think that was like the darkest and the scariest and the least travel-y. And the fact that they were voting for you is a real testament to the way that the place sticks in their memory, to their desires, their consumer desires, their traveler desires, and to kind of what consumers want. And so I think I would encourage you all to look at this year's wins as something special and unique that really show your primacy in the minds of your loyalists. Secondly, though, I would point out that I think that as travel patterns change, as we emerge from the pandemic, as we've already begun to travel again, especially domestically, I think that there's going to be more stock placed in the near future on what I kind of call peer approved travel, right? So I think that this list has greater importance than ever. Obviously, it's grown in importance every single year, and I think that the way that the role that it's going to serve for travelers this year is going to be more biblical, if you will. I think in addition to the kind of tried and tested imprimatur that the list gives your destination, it's also important to note to the point about how travel behavior is going to be different in the next couple of years. The importance of travel destinations that are comfortable and accessible and don't require too much work, but give you an experience that is really different from your day-to-day and that is consistently excellent. And I think that describes your product to a T, and lean into that in your messaging to the people who know you and the people who haven't been there yet, because I think that everybody's going to want to come in 2021. Thanks so much for having me here.
Jesse, thank you, and we're honored to receive it again, and we look forward to staying in touch and working together in the future.
We so value your partnership, and we feel the same way.
Have a great rest of your day, Jesse.
Thanks, you too.
Thanks. All right, that was Jesse Ashlock, and we're certainly honored to have him on this call this morning and hearing more from Condé Nast. Our next speaker is thanks to her and the company that she works for. The students in Beaufort County Schools certainly have a leg up on learning. And due to that partnership with the Chamber's Project Connect program, 1,000 students in our schools now have the headphones they need for technology at home and in the classroom. Tracy Montross is the regional director for American Airlines, and she and American Airlines donated those headphones. And we're extremely grateful for that gift. And this morning, she's going to talk to us about the impact of COVID-19 on airline operations and how American Airlines is working to restore the consumer confidence in air travel. Tracy, thanks for joining us. It's great seeing the American jet there in the background, and welcome to our call.
Thanks so much, Bill. Can you hear me okay?
We sure do. Thank you.
Okay, I'm going to go ahead and share my screen here so we can run through this presentation. I'll try to be quick with some of this content, but as you can imagine, this has been a pretty devastating few months for commercial aviation. And so just wanted to run you through some of the impacts on our business, on our employees, and on our service in the Palmetto State, and happy to answer any questions afterwards. Just a quick snapshot. American's been around for about 95 years. We've seen a lot of turbulence over our history. Our headquarters is based in Fort Worth. Before COVID, we were flying about 6,700 daily departures to 340 destinations in 57 countries. Before COVID, we had about 130,000 global team members, and 85% of our team members are unionized, which is the most of any airline. In South Carolina, before COVID, we were the only airline serving all of the airports in the state, including Florence, in which we were the only carrier. Out of Hilton Head and Savannah, proud to serve those two stations, and actually increased our service this past summer to Hilton Head Island with seasonal flights. 3 new hubs this summer to DFW, Chicago, and Philadelphia. We're fairly pleased with the results. And so while we're back in the winter season with just our daily flights to Charlotte Douglas, it did perform well. And again, we're hopeful that when folks are traveling again, that we'll be able to return to that 2019 schedule, Savannah, 18 daily flights to a number of different hubs. Savannah is down about 30% in service for the calendar year in 2020, but that's pretty standard across the network given the reduction in travel demand. We do hope to bring DCA Savannah back, but DCA is actually significantly reduced in its number of daily departures. Today, we're only flying about 60 departures out of DCA, Washington Reagan. Usually we have about 255. So again, while I know that there's a lot of interest in your region for that service to Washington, D.C., unfortunately, the demand isn't there, and we just don't have the capacity available out of Washington Reagan to continue to serve that route. I'd say the same story is available. Same story for LaGuardia. in the New York market. But we'll be watching for recovery and hope to make some capacity decisions to return our share of schedule by at least 2021. That's what we're hoping. And so this is just an example of how the bottom has fallen out in commercial air travel. The impact is, a 66% decline in domestic travelers, 84% decline in international passengers. This is for all U.S. airlines. And we're all facing a significant reduction in net booking revenue. U.S. airlines are burning about $5 billion in cash a month. For American, that's about $30 million a month. And that's just significant. I mean, a terrible and devastating reduction in bookings and forecast. We have as an industry, about 1,800 aircraft are still parked. For American, it's around 140 aircraft that are still idled in our fleet. And, those are aircraft that we're still paying debt service on and still paying for those fixed capital costs. So it's really important that we get folks traveling and improve that consumer confidence. We know we have a responsibility as an essential service to ensure that healthcare workers and PPE manufacturers, energy and supply chain managers, and other critical infrastructure employees are able to get to their destinations, even at the height of those safer at home orders. And so while American processes have always met or exceeded CDC standards, we have improved and are continuously working on our processes to ensure a safe and clean experience. And that includes the airport, onboard our aircraft, ensuring our team members are healthy, and providing some other measures for the customer to have confidence when they travel. That clean commitment exists throughout the entire airport experience, whether it's at check-in, in the Admirals Club, boarding at the gate, or at baggage claim. These are enhanced cleaning measures, health assessments that you do when you check in, required mandated face coverings on board the aircraft and in our airports. And so I will add that that face covering is mandated, and we are enforcing that on board, and that's really made a difference. Hand sanitizer, social distancing, plexiglass barriers, and a touchless experience as much as possible. Hopefully some of these things will stick around after the pandemic is over and there's a vaccine. I think you will see a long-term commitment to continuing some of these touchless experiences and new innovations in cleanliness. On board the aircraft, please know that there is enhanced cleaning at every turn, medical grade disinfectants used on board. We're the only airline to be using Surface-Wise 2, which is the only product that's been approved by the EPA for continuous 7-day protection. It's performed weekly and kills 99.99% of viruses and bacteria, and that's used as an electrostatic sprayer on board the aircraft. So lots of cleaning happening on board, and very, very excited about the improvements here, and do believe that they will stick around well after this event is over. For our team members, ensuring that they are healthy when they come to work, and that there's layers of safety to ensure their interactions with our customers are safe and secure. We've increased the amount of cleaning within their spaces. Again, mandating face coverings very early on, temperature checks and welcome work assessments every day, and ensuring that there's social spacing in the workplace. We've also got 14-day paid pandemic leave, priority testing, and unfortunately, as of September 30th, the job protection program did expire. We'll talk about that in a minute, but we've had about 39,000 employees take voluntary leave of absence and early out programs, which has all helped to improve Americans' financial footing. We're working with other third-party partners on accreditation and to gain their expertise, and this, again, their advice is helping to improve our processes. We're working with Vanderbilt University and have the Global Biorisk Advisory Council accreditation for all of our aircraft and lounges. Now, for our customers, because we know that there is this fear out there of travel, we want to make sure that we're doing everything we can to ensure their confidence when they're flying with American. And that means improving not just the cleaning experience, but giving customers the flexibility to make their travel plans and the flexibility when they need to make changes. So we've made some very exciting announcements, and that includes extending travel waivers and refund policies, no change fees for most domestic flights. And so that again, when you book, you know that you have the flexibility if you need to change your plans because of a COVID-related change or a change in health, whatever it may be, that you can use the value of that ticket going forward. We've extended our elite status for those road warriors who are checking their mileage balance, and then again, hoping to offer more flexibility and standby for free on same-day flights to same destinations, and more advantage benefits when purchasing a basic economy fare. We are surveying our customers very regularly and getting a sense for what they want to see from the airline. But we do know about 9 out of 10 customers that have traveled in the last 30 days have said their cleanliness expectations were met. And we're working hard with our corporate customers to make sure that their teams have the confidence to put folks back on the road. As you may know, about 80% of corporate clients currently have a travel ban, restricting any business travel through the end of the year. And so we're working hard to get in front of our customers and through our chamber partners to help give you the confidence to put your employees back on the road when you feel it's necessary for them to travel. We're also trying to enhance the customer journey by giving a travel tool available via our website. It's powered by Sherpa. It's really cool. If you go in online, you can put in your destination. It'll pull up all of the travel guidelines associated with that destination, so you know what to expect when you get there. And then this pre-flight COVID-19 testing program is really exciting. We're piloting it in a number of stations, particularly before international travel and travel to Hawaii. As you may know, so many different destinations right now have mandatory quarantines on arrival, but we're partnering with governments in the Caribbean, Jamaica, Hawaii, and we hope other European destinations to say, if you take a pre-flight COVID test with us, when you arrive in that country, you're not restricted by their quarantine measures. And so we hope that that'll make a bit easier for folks to commit to travel. Now, the payroll support program, you probably heard a lot about this. This is getting a lot of attention even as of yesterday with a number of tweets. This is a program that was initiated in the CARES Act. It provided direct salaries for aviation employees through September 30th. And that really helped to prevent a significant number of furloughs while also giving some certainty to aviation and to airlines. This was vendors, contractors, and airline employees through that period of the summer where we just didn't know when demand was going to return. We really thought that demand would be back in place this fall. Unfortunately, that's not the case. Congress continues to debate whether or not and when this program should be extended. Again, it would be direct salaries for about 19,000 American Airlines employees and a number of other team members across the industry. So about 100,000 jobs total. Unfortunately, that did not pass for the deadline, so furloughs are taking effect. One of the other things that was associated with the payroll support program was the continuation of air service to regional stations that otherwise don't have the demand right now to justify that daily service. So unfortunately, stations like Florence Regional Airport will have a suspension of service October and November until we know what the future of the PSP is and whether or not demand will return to those markets. So we are kind of in a waiting pattern right now and to see if this PSP can be extended, because this would really make a difference for our team members who are highly certified, highly regulated, and by them leaving the workforce, that then delays the ability for the airlines to pick back up when demand returns. It means that we'd have to go back out, rehire, retrain, spend the money and the time to, in simulators and in different training exercises to make sure everyone's recertified. So PSP really helped us avoid that. So again, we're hopeful that that PSP will be extended. There's again, this changes by the day, but certainly anything that your community can do to continue to advocate for the extension, we certainly appreciate. Beyond that, happy to answer any questions, but just wanted to say thank you again to the Chamber for allowing me to share this information today.
Tracy, thank you. And a few questions, if you have time for them. The first one's coming to us from Meg, and Meg is asking, will the enhanced cleaning on the aircraft remain going into 2021?
It will, yes, and certainly through when there's a vaccine. But like I said, I fully expect that there will be a continuation of these processes for the long-term future. We know that there is, while we've always met CDC expectations, we know that there's more that we can do, again, to improve the cleanliness environment. I will add that the HEPA filters on board the aircraft are hospital grade, so we know that the likelihood of transmission on board the aircraft is low. But I think what you're seeing in airports, and we have a great partnership with John Rembold at Hilton Head-Island. I know what he's doing and what so many other airports are doing to improve their cleanliness standards. Those are things that customers will want to see for the long-term future. So I think a lot of that will stay in place.
Great, thank you. Next question is coming from Rick, and Rick is asking, will change fees remain post-pandemic? Do you anticipate the elimination of change fees post-pandemic?
I can only say what's in place now. And again, we don't really know when this event will end and when demand will return. But yes, the policy is in place, through without an end date, and so we'll see. But I do expect that we're going to be looking for every opportunity to increase the flexibility and products that will bring people back to travel. And so this is one that we're committed to offering now, and hope that folks will make those bookings and make their vacation and destination plans, and that change fee product elimination it helps to give them the confidence to do so.
All right, thank you. Next question is, what is American's commitment in regard to onboarding seat assignments?
Good question. So we have not changed our onboarding process. And actually, I would say that there's plenty of research out there that says that the boarding process does not affect the transmission rate. As I mentioned, the likelihood of transmission on board the aircraft is significantly low because of those HEPA air filters. What we've seen is, even our pilots and our flight attendants, those who are on board the aircraft, the transmission rates within our own workforce are so low that the data is really not there to suggest that there's higher risk on board. And so we're not making changes to the boarding process now.
All right, thank you. This is a comment from a colleague of mine at the Chamber who just wanted to simply tell you that she traveled in July, flew on American, and felt very comfortable, and wanted to say thank you to you and everyone at American Airlines for that safe experience.
Well, thanks for saying so. We hope you'll be back.
From what I understand, she's planning on another trip fairly soon. Tracy, we want to thank you for joining us this morning, and also your and American Airlines commitment to Hilton Head-Island, as well as the Savannah Hilton Head International Airport. We are partners. We're in this together, and the better that your airline does, is the better that the success of Hilton Head-Island goes as well. So thank you, and also on behalf of many students in Beaufort County, thank you for the gift of the headsets. Greatly appreciate it.
Well, thank you, Bill, and thanks for asking. I mean, we have Biscoff cookies and peanuts and pretzels and earbuds for days as they're not being placed on board. But it really took the initiative from your team to ask for that support. So we were happy to offer it up, and want to say thank you again to everyone who attended today's meeting.
Great, thank you, and we look forward to hopefully seeing you soon. All right,
you got it.
That was Tracy Montross, and we're going to continue with our travel sentiment here, and being able to say it's a great day in South Carolina would be an understatement. South Carolina fared extremely well in yesterday's Condé Nast travel announcement with best places to be in travel. Charleston was once again named the #1 small city, and Greenville has also made that lineup, as did some of our other resorts and islands. And here to give us an update is the Director of South Carolina Parks, Recreation, and Tourism, Duane Parrish. Duane, it was a great day yesterday, and I'm sure we'll continue to have great days ahead.
Yes, it was. Thank you very much, Bill. And South Carolina certainly carried more than its weight yesterday in terms of rankings with Condé Nast. Congratulations to Hilton Head being the #1 island, and congratulations to Charleston, as you pointed out, being the #1 small city. And right behind them were Greenville and Kiowa Island behind them, respectively. So big day for South Carolina, someone our size. Only California matched the number of places we had. So pretty impressive, and congratulations to you and the island and everyone else. So I thought first of all, thanks for having me back. It's been a few weeks since I've been on, and I appreciate the opportunity to talk again. I've got a few numbers, and Tracy made me look bad. I guess I should probably have a PowerPoint presentation like she does, so that'd be easier to see, and maybe bring a gift for next time. But nonetheless, I think it's important. I'll share some of these numbers with you. And I'll start as usual. The number of hotels closed, we're down to 13, which is our lowest number since the pandemic started. And really, those are just closed for non-COVID reasons, renovations, other things at time of year and so forth. So I think everyone that is going to be open this time of year is back open and carrying on business as such. And so I thought I'd start with hotels first. The most recent week of hotel occupancy I have is for the week ending September 26th, which is the Saturday before last. For that week, hotel occupancy across the U.S. was 49%. The Southeast was 48%, and South Carolina was 51%. Once again, Hilton Head/Buford led the way at 64%. Very impressive. Congratulations to you once again. You certainly, Hilton Head and Beaufort County have certainly led the way in occupancy nearly every week since the beginning of the summer. And while the numbers are still down, at least it's good to be at the head of that pack in that regard. In regard to that occupancy, we seem to be up over the 50% mark, at least in our state now, and are slightly ahead of the rest of the country and ahead of the Southeast, which is good, but still well down below our normal levels. For the month of August, the monthly numbers, I do not have September yet. We'll likely have those on the next call. But for the month of August, the occupancy numbers were 48.6% for the U.S., the Southeast at 45.9%, and South Carolina at 48.8%. Hilton Head, Buford led the way at 59%. August was not as good as July, but so we did take a slight step back. If you remember, in about mid-July, cases sort of peaked and then didn't really flatten back out until September, which obviously has a dramatic effect on travel. And I think we saw that in some of the numbers that came through for August. And the ones for September, the weekly numbers I'm getting are up a little bit slightly now. Again, going back to my crawl, walk, run process, I think that's sort of, we're still sort of in that walk phase, if you will. Lastly, I'll finish up with in regard to numbers, short-term rentals, which for those not familiar with, that's, AirDNA, VRBO.com, HomeAway.com, those places, obviously, which a lot are in Beaufort County. So the U.S. ran 66%, the Southeast ran 61%, and South Carolina ran 63%. Leading the way was York County at 69%, followed by Beaufort County at 67%. Obviously, as you can hear, these numbers are substantially ahead of the hotel occupancy numbers. Short-term rentals continue to perform well. Those numbers were were pretty flat to last year. These are extremely good numbers in regard to that, particularly when compared to the hotel side. Again, still indicating that the traveler is looking for that additional square footage, additional ability to prepare their own meal, and the ability to social distance within the places they stay as well. I look for that to continue throughout the fall. I will say I'm more encouraged about the fall than I am the summer, from looking back at than I was in June about the summer. So there are still 2/3 of the people in the country surveyed last week that still intend to travel in the next 6 months. That bodes well. The bad news is a third are not going to travel, but we're going to certainly do our part to capture more than that fair share of those 2/3 that will travel. Most of those trips are shorter. They're likely by automobile instead of airplane. While airplane traffic is picking up, as you heard Tracy, it is still well below where it was before. So people are going with destinations they're familiar with and taking shorter trips. We're certainly still trying to maximize that. Well, we do in South Carolina have beaches. We have the fall leaves that change color in the fall up in the upstate around the blue edge of the Blue Ridge Mountains, which bodes well, and bookings are up for that part of the state for this fall as well. Along those lines, state parks continue to perform very well. Our fall bookings throughout the state for cabins and campsites are well ahead of normal pace. Outdoor activity is still at the top of travelers' lists. Last week, we in our state parks opened a new nature center at Huntington Beach State Park, which replaces the one that burned down 3 years ago. It is a phenomenal place that we average about 2,500 students a year through. It has a touch tank and a lot of things you would imagine around marine wildlife, both indoors and outdoors there. So if you're in that area of Huntington Beach State Park, which is around Murrells Inlet, I'd certainly encourage you to stop and see that. As you may have heard or read, last Friday, the governor changed the executive order or amended the executive order regarding restaurants. Restaurants are now allowed to go up to 100% capacity as of last Friday. This does not mean that all restaurants will do this, nor by any means is it required. But the South Carolina Restaurant and Lodging Association came to the state over the course of the last 3 or 4 weeks with a plea to try to increase the percent of occupancy. You know, this has obviously been an extremely tough time on our industry, more so than any other. Within our industry, restaurants have probably been hit the hardest along with hotels. And so this is sort of a, going into the fall and then followed by the winter, which is typically a slower time. As the months get colder in December and January, more difficult to eat outside, which has certainly been the preferred trend of the last 4 or 5 months. So this was initiated by the Restaurant Association as a possibility for them to increase where they can. Some restaurants will not have the demand. Some restaurants will choose to stay in the current mode of 50%. Some will increase some of their occupancy to maybe 70, 75%. But certainly the consumer can still walk in the door and see whether they're comfortable or not. Again, this is not intended to put that kind of pressure on a restaurant to necessarily do it. The marketplace will sort of make their decision by looking in a place or hearing from others through word of mouth whether or not they feel comfortable within that space of whatever that restaurant may be doing. Mask requirements are still in place for restaurants. The 11 o'clock cutoff of the sale of alcohol is still in place. Those have not changed. But hopefully this will allow some restaurants to perform a little better than they have in the past, and quite frankly, not be forced to close as we go through this winter. Bill, pending any questions, that concludes my report, and I appreciate the opportunity today.
Thank you for being with us this morning. And just on as far as looking at occupancy for Hilton Head Island for the week of starting, say, October 9th through the 15th, we're anticipating hotel around between 60 and really 64% for the week, and then a little bit of gain for the home and villa occupancy being close to about 76% for that week. So we're encouraged by that. Question for you, Duane. First one's coming from Tim, and Tim is asking how it feels being the tourism director for the #1 island as well as the #1 small city.
It's a great feeling. I've been very fortunate to feel it before. In the year of the pandemic, I can't tell you how good it makes me feel. Obviously, coming out of this, we as a state use all the good publicity we can get. It's great to have that. Condé Nast is a great partner. They have the wonderful demographics of their readers, the kind of visitor you want. So, I'm excited for South Carolina. I've always said, it's one of the best products in the country to sell, and that's this wonderful state of South Carolina. So a very good feeling, and congratulations to everyone involved.
Duane, thanks for being with us, and we appreciate you and all you do, and we'll talk to you soon.
Thank you, Bill. Good luck.
Okay. Thank you. Bye-bye. Our next speaker, we're going to turn our attention a little closer to home and for the focus for our next guest to talk about what our hospitals are experiencing on the healthcare front. And I'm pleased to welcome back to the call the market CEO of Hilton Head Regional Healthcare, Jeremy Clark. Jeremy, thanks for joining us again today. think we're having some. I think we're having just a little bit of difficulty connecting with Jeremy. And Jeremy, we're going to put you on hold for a minute, and we'll flip it around here for a minute, and we're going to ask for Dr. Jane Kelly with the South Carolina DHEC, who's been kind enough to be with us for the last several weeks, and she'll talk to us a little bit about statewide news relating to COVID and some other trends that she and DHEC are seeing. So, Dr. Kelly, welcome, and glad to have you back today.
Well, thank you. Thank you for inviting me. Can you hear me?
Yes, we can. Yes, we can.
Okay. Okay. As schools are reopening, I thought I would talk a bit today about COVID-19 infection in children compared to adults. Talk a little bit about transmission, recommendations DHEC has made to keep schools safe, and a little bit about the timeline of illness. But first, the numbers. So statewide, South Carolina has had in the past week 4,305 new confirmed cases. That's for a total of 147,800 cases statewide, and 102 new confirmed deaths for a total of 3,275. During that same period of time, Beaufort County had 78 new confirmed cases for a total of 5,707. So statewide, South Carolina cases, new cases have plateaued, but Beaufort County is in a downward trajectory. So we hope that you can maintain those gains. There were 2 new confirmed deaths in Beaufort County. That's for a total of 82 confirmed deaths since the pandemic began. Hilton Head had 22 new confirmed cases for a total of 1,026. And Bluffton had 28 new confirmed cases for a total of 1,665. To talk a little bit about school reopening, we all recognize the importance of in-school, in-person classes, the learning, but also socialization, kids who are given free or reduced cost lunches, but just physical, emotional, and psychological benefits. And there are many examples of safe school reopenings in other countries and in places around the United States. For example, school reopening did not lead to increased case counts in the Netherlands, Finland, Belgium, Denmark, Austria, Taiwan, Singapore. And we have examples of safe reopenings in the United States of childcare centers that opened during the summer. So it shows it can be done. One of the unknowns early on in the pandemic was how contagious children are. They were thought maybe children are, because they have such mild symptoms, maybe they can't transmit the disease. Many children have mild or even no symptoms. But we know by now that asymptomatic people, including children, can transmit the virus. And so that's been a big concern, not just for transmitting the virus among children or youth, but also the fact that there was concern for spreading to teachers and staff and to other students who would then bring it home and spread it to relatives. DHEC had recommendations that I'm very impressed that schools have really taken to heart, with implementing safety measures around wearing masks, keeping distance between desks, and a number of schools have been using plexiglass dividers between student desks that also seem to be very effective. As of today, there is still some concern because we are seeing cases start to increase among children as schools reopen. And statewide, there have been 741 cases among students and 301 among employees. And that doesn't mean that they caught it at school. They certainly could have become infected in their home or community environment. And the good news is we're not seeing a lot of outbreaks spreading through schools, and that we're not seeing a lot of secondary transmission. Specifically for Beaufort County, most schools have had 0 cases. There are a couple of exceptions. Hilton Head High School and May River High School have each had fewer than 5 students and fewer than 5 staff. But there was some concern there about possible transmission, but it hasn't been like a huge outbreak. There are some other schools that have had at least 1 case among students or staff: St. Gregory the Great, Beaufort High, Coosa Elementary, Hilton Head Elementary. But again, we're not seeing big time school spread, and that's very good news. And kudos to schools and to students for trying to contain transmission. I'd like to talk a little bit about the timeline of illness, and that's part of the tricky nature of preventing transmission, because there's an incubation period of 2 to 14 days. What that means is from the day that you were exposed to a virus to the time you develop symptoms can be anywhere from 2 days to 2 weeks. And yet during that time, even if you have no symptoms, you can transmit the virus, transmit the infection. So that's really tricky when it comes especially to kids but even adults, 20% of adults are asymptomatic. They don't develop symptoms even though they have the virus. So, how do you manage a situation like that? Well, one of the recommendations we have had, in addition to the wear your mask, social distance, don't go in big crowded arenas, to maintain your distance from other people, is also an increased focus on testing. In the early days, we didn't have enough tests to go around. Now we have many more tests, and we've got, in addition to the nasal pharyngeal tests, the swab tests, there are saliva tests, there are rapid tests that just use a swab in the front part of your nose, not going way back in your nose. And we're encouraging people to be tested with some regularity as a screening test. They're much more readily available. The clinical course, though, for most people is that they have, I said that 20% of adults can be asymptomatic the entire time, but 80% of people do develop some symptoms. Usually they have no symptoms for the first 48 hours that they are infected. Then they get mild to moderate. And I'm sure you've all seen the list of a lot of very strange symptoms, some of which have crossover to the common cold. You're not sure whether your runny nose or your cough is from just a cold, or as we get later into flu season, whether it was the flu or COVID-19. And that's why we encourage, even if you're just mild symptoms, get tested so that you can prevent spreading the virus to others. Then after those first 48 hours, and people develop mild to moderate symptoms, most people do not progress to have severe symptoms. But this is a funny virus. It does not stay limited just to the lungs or the upper respiratory system. It can spread through the body and it can affect any organ system. And it causes something called vasculitis. Anything that ends in itis means inflammation of, like conjunctivitis, dermatitis, otitis. They all mean inflammation of those organs. When you have vasculitis, that's an inflammation of the blood vessels. And that can affect any organ in the system. And the people who have gotten severely ill, usually they take a turn for the worse at about days 7 to 10 of infection. And they experience something called cytokine storm. You may have heard of that, or a hyperimmune response, where there's just total body inflammation. And that's one of the reasons I think that one of the medications that can be administered to counter that is dexamethasone, a steroid. So the usual process of treating people who are having severe disease is to give them a drug called remdesivir, which is a virus blocker, basically, so that it decreases activity of the virus, and dexamethasone, a steroid that reduces inflammation. It blocks that cytokine storm or that hyperimmune response. The last thing I wanted to mention has to do with death rates. It is rare, but not unheard of, for there to be a pediatric death. Nationwide, there have been about 1,000 kids who, under the age of 10, who have experienced something called multi-system inflammatory syndrome, but there have been fewer than 100 deaths. In South Carolina, we've had about 27, I think the number is 27 kids who have had this syndrome, but none of them have died from it. This is in contrast to deaths by age group. About 80% of deaths nationwide, and this is true for South Carolina as well, were in people over age 65. but not necessarily the very elderly. We've certainly had deaths in younger age groups. I mean, there have been tragic deaths in teenagers, young adults, middle-aged adults, but the risk of death does dramatically increase with increasing age. There's still a lot we don't know about this virus. There is new information about its biology, new information about what medications and what treatments are appropriate and work. We in South Carolina at DHEC are working on a vaccine administration plan, but we still don't even know which vaccines are going to come out first. So, the name of the game is trying to stay ahead and plan for the future, but with so many unknowns, that is a constant challenge. So my recommendation is the same old, wear your mask, stay socially distanced. I think Beaufort County and South Carolina as a whole are showing the ability to at least maintain the gains. I'm sorry to hear that South Carolina was in a downward trajectory, but I think as kids go back to college, we're seeing more cases among young adults. Hopefully we can get the message out to them and try and bring those case counts down. And hopefully in the next few months, we have a vaccine that will help. And with that, let me ask if there are any questions.
Dr. Kelly, thank you so much for that. The first question is coming to us from Tim. And Tim is asking, what is the length of time to get the results of a saliva test?
It depends upon the lab. And I say that because there are some labs that have been overwhelmed and they didn't have enough reagents. But the turnaround time, the saliva test is also a PCR test. It's one that has to do in a special lab. So it's not a rapid test. It's not a your results in 15 minutes. But if it's done at most labs, it should be now a turnaround time of 24 to 48 hours.
Okay, thank you. The next question is coming from Jill, and Jill is asking, if I have an employee that tests positive, where can I find the protocol on the next steps I should take?
And they're on the DHEC website. If you search for DHEC COVID employer, it will take you to a number of guidelines about what you as an employer should do, what the employee should do, what to do for workplace cleanliness, and some information about contact tracing.
All right, very good. I've had a couple of other questions that you actually covered during your report. And I want to say again, thank you for being with us, and also the positive news about Beaufort County with the downward projection. That's encouraging for us, and we'll continue to do our part.
Thank you.
All right. Thanks again, Dr. Kelly. Now we're going to go back to Jeremy Clark, and Jeremy is the market CEO of Hilton Head Regional Healthcare. Jeremy, if we've got you now. Yes, we do.
Hey, good morning, Bill. Can you hear me this time?
Good morning, we do. Thanks for joining us, Jeremy.
Excellent. Very glad to be back here. Sorry about the communications issues earlier, but what I was saying was I was very appreciative of being back and very excited to be on today's call where we're celebrating being recognized by Condé Nast. It's a great recognition for our local community and our state as well. So it's great to be here with this group. I'll start off like I usually do, giving everyone an overview of what we're seeing locally. This morning at Hilton Head Hospital and Coastal Carolina Hospital, we currently have a total of 2 COVID positive patients hospitalized in our 2 hospitals, with one of those being in the ICU. It's always important to remember there are daily fluctuations in the numbers, but the overall trend, similar to what we just heard from Dr. Kelly in Beaufort County, the overall trend is declining from those mid-July highs that we saw a couple of months ago. So our 2 hospitals still have plenty of capacity in both our medical surgical and also our critical care beds. But while we're not seeing a surge of COVID patients right now, we are remaining ready. We have ample supplies of PPE, personal protective equipment for our staff to use. We have access to the drugs and treatment protocols that COVID patients need. And we're constantly monitoring the situation as well, and know that we can implement plans, as the situation dictates. So it's important we remain vigilant. It's important to continue wearing masks, continue washing your hands, continue keeping your distance from others. You know, as Dr. Kelly talked about testing, and throughout the course of this situation, we focused on increasing access to testing in our community, and we're going to continue to do so. It was on this call a couple of weeks ago where we announced that starting on September 1st, we would start performing tests without a physician order and at no cost to patients. And in the first full month of that, we tested over 2,800 individuals in September through that process. There was another question about turnaround time a minute ago. Right now, we're getting test results back to patients within 48 hours, which means we had patients that were tested here on Monday morning. Some of them we got the results back and called them last night. Others, the rest of them, we will contact today. So 24 to 48 hours is still a good benchmark for that turnaround time. You know, in our testing events, which we conduct each weekday morning on the campus of both Hilton Head Hospital and Coastal Carolina Hospital between 8 and 12, we are continuing to see people test positive. The majority still remain local residents. Very few are from out of town. But thus far, most continue to have symptoms that are less severe and not requiring hospitalization. So we are continuing to see patients test positive. That positivity rate is holding pretty steady in between 5 and 10%. Of the people that we test. So that's down from the mid-July peaks that we saw. There was a question earlier just now on employers, and I think it's always important to remember that employers know that the CDC is not recommending that organizations require their employees to get a negative test before returning to work. The CDC has moved to symptomatic recommendations where an employee's ability to return to work is based on their lack of symptoms, not necessarily receiving a negative test. So I know Dr. Kelly referenced the DHEC website, which is a great resource on this, as is the CDC website for those employers that are interested. But, you know, having access to testing is just one component of our Safer Standard program. We're also focused on screening, spacing, cleaning as well. So all of our patients and staff are still screened for symptoms upon entering the hospital or starting their shift. We have appropriately spaced all of our waiting areas. We've even added walls in certain areas to provide even more separation between different areas. We've enhanced our cleaning protocols and added cleaning staff as well, just to ensure that greater focus on cleanliness. So we've used these 4 principles of testing, screening, spacing, and cleaning to mitigate the spread of this disease and create a safe environment of care. We know it's safe for our patients. The vast majority of the patients we are treating do not have COVID-19. It's also safe for our visitors. You know, we are allowing 1 visitor today for patients on our inpatient units, 1 visitor for a patient in our ER, and 1 visitor for patients who are having surgery as well. We know that visitors are an important part of the healing process, and we're glad to be able to allow them back into our organization and doing it on a safe manner. Just to wrap up, you know, I want to remind everyone our hospitals remain ready. We've created a safe environment to deliver care. We've seen a decline in the number of COVID hospitalizations over the last month, but we remain ready to handle that surge and really to treat all COVID patients and all non-COVID patients that we're seeing. We, as always, appreciate the leadership from our state and local officials and really appreciate everyone's support for our caregivers. I want to remind everybody, wear a mask, wash your hands, and keep your distance. And Bill, I'll turn it back over to you for any questions.
Jeremy, great update today, and we've missed you the past few weeks. Delighted to have you back today, and thank you for the encouraging news as well as some other protocols to take. So we're gonna close out with you today, and we appreciate everyone being on, and I'll certainly remind everyone to be kind and stay safe and wear your mask. Thanks for joining us today, and we'll talk to you next week. Have a great rest of your week. Bye-bye.